I'm not a very technical person, so coming to an event in which I can understand something about API, what they mean and what the opportunities are and how they present us to us in our work in NHS Wales, I think that's a real plus for me. So I've really enjoyed this morning.
Yeah, I thought it was incredibly interesting. I think it's fantastic to see the collaboration between various health organisations, the Life Science Hub and industry. And it's a very informal setting, it's very easy to access people. Some fantastic presentations actually, and also a very good Q&A, which where I think we're all getting together and sort of debating some of the emerging issues and challenges and really trying to develop a connected health system.
Excellent, yeah. So particularly getting the developers in the room, so already making a few connections really. So I've got a follow up with one developer at the tram shed in Cardiff to meet up with them in a few weeks, who's keen to get involved and lend support to the API platform they're trying to develop and get his developers involved with that, which would be really good for the NHS, that sort of engagement and involvement.
So bringing together industry, academia, NHS and social care providers is an absolutely integral part of what the ecosystem is trying to do. Getting people into the same room so that they can talk about common problems and identify how they can work better together is a key ambition of the ecosystem.
I particularly enjoyed Charlotte Nielsen, I think, who was talking about Open API platform and giving the example of Royal Mail. And actually I tweeted on this, wouldn't it be cool if we had our own NHS Wales internal API library, which would allow us to actually exploit the talent that's in our organisation, to start using our existing national and local systems dynamically in ways we may not have thought through.
Yeah, I thought what was very interesting was actually Pierce's presentation, where he was talking about the value of APIs in real life healthcare use cases. I thought what was very interesting about that was the debate that there is around standards at the moment, and that there's no sort of panacea, and that we're all sort of trying to work our way through, but understanding realistically where the limitations are. And I thought that was a very interesting technical perspective on essentially what we're trying to do is to sort of deliver better care for patients through more of an integrated health system.
Our next event, which is on July the 16th, going to be in here in the Hub. We're going to have a tech and pitch day. It's going to be your chance to come and play with new technology and see how it works. It's also going to be your opportunity, if you're looking for help or a partner, you want to pitch out to an audience of NHS and industry, this will be the place to be.